This is Heart Rhythm TV. I'm Roderick Tung. Left atrial appendage occlusion on the heels of the option trial is increasing in worldwide adoption. How do we do it? Do we use a TEE? Do we use ICE? And in this month's featured article in Heart Rhythm Journal, we have Frans Serpa on Heart Rhythm TV discussing his contemporary meta-analysis on ICE versus TEE guided procedures. Frans, welcome.
Thank you for the invite. Honored to be here.
And I know this is a great new meta-analysis led by you and Dan Kramer on behalf of the Beth Israel Outcomes Group. Tell us why this is an important question for you.
Yeah, absolutely. So as we all know, like the use of left atrial appendage occlusion has gained a lot of popularity over the last years. And with that in mind, we were interested in conducting an updated meta-analysis to evaluate procedural outcomes and safety on a large scale, focusing specifically, as you said, on the comparison of intraprocedural imaging guidance with transesophageal echocardiography, or DE, which is a more standard approach, versus intracardiac echocardiography, or ICE, which has gained a lot of popularity. This was relevant for us because, it allowed us to evaluate procedural outcomes and safety overall at a large scale and across regions, and also identify real world challenges associated with the implementation and learning curve of ICE.
And I think our viewers understand that this is a very important pragmatic issue about implantation, because as we get to concomitant procedures, then having your imager on standby and scheduling them separate. Whereas right now ICE has been a huge revolution in, invasive electrophysiology, where we're able to visualize everything we're doing in real time, monitoring ablation contact, monitoring ablation lesions, really starting to understand the intricacies of cardiac anatomy and understanding neighboring adjacent structures. So it really makes sense that we evolve towards more ICE-based procedures. So you look at over 40,000 patients and you found that over 10% had ICE. Take us through a little bit of your findings, because I see we have some really nice forest plots here in figure 2A and B.
Absolutely, happy to do that. So as you said, we basically conducted the systematic review and meta-analysis, including 19 observational studies with the amount of patients that you mentioned. And overall, the key takeaways is that in our study, we found that ICE was associated with a higher procedural success, which was marginally significant, meaning it could be like either for ICE or TEE. But more importantly, I would say is that there was no difference in the overall complications rate, which is very important and reassuring for providers performing this procedure. In addition, we found that with the use of ICE, there was a higher rate of pericardial effusion and some residual iatrogenic ASD as well.
And presumably the iatrogenic ASD would probably depend on the type of surveillance, the definitions as well. And obviously all of the ICE procedures we're talking about are left atrial ICE. We're using a large bore across the transeptal and then also having an ICE catheter, which would make sense.
Exactly, yeah.
So do you think that this will change clinical practice?
I would say so. Yeah, I think, as you mentioned, there's just a small percentage of ICE that it was done and included in this study, but it also tells us that, it's gaining popularity. People are becoming more familiar, and definitely is giving us more like precise imaging and also showing that it can improve outcomes as well, and with similar safety profiles. So I think it will definitely change because more providers will start to gain more familiarity, will use it more often in their practice. So definitely will change in the upcoming future. Potentially we'll see more studies in this realm, but definitely it's a big start.
And Dr. Serpa, you did a regional analysis looking at geographical location. We know that ICE is a luxury in some areas of the world, definitely limited by expense. We see that in Asia. We see that even in South America as well. Tell us what you found there.
Yeah, that's an interesting approach that we took in this study specifically. I think the bottom line here is that procedural success appears to be consistent worldwide with ICE, which is great. But when we take a look into complication rates, we see that there's some sort of differences based on group interactions by region. And so we saw kind of a lower trend towards Europe, which kind of speaks of the learning curve that they have since they started like a little bit earlier versus the US and other regions. And so this is very important. I think it's kind of speaks or reflects kind of the difference in operator experiences. As you said, techniques, equipment, availability in healthcare systems, but also points towards like the future direction, which is potentially additional training and standardized techniques and protocols and proctoring opportunities as well.
So let's talk about the future. Do we need a randomized trial? Is this going to evolve on its own?
I would say so. I think that's one of the points that we made here in our study. And, there's a lot of observational data here, but definitely we have to confirm that and validate these findings with potentially a randomized clinical trial. It will also be helpful because it will allow us to assess more outcomes, I would say, probably longer term outcomes as well. And I will also say that even cost-effective analysis would be great in this topic as well.
Well, congratulations, Dr. Serpa, on a fine meta-analysis and being featured in Heart Rhythm Journal. I hope all of our authors read this, reflect on it. And I do think it's interesting to predict, with concomitant procedures, will we start moving away from TEE? Will we be able to streamline this better and be able to be our own imagers? We clearly see that this is a movement that's happening, but obviously need more of these sort of data prospectively as well to confirm safety and the ability to decrease, the leaks and the DR, which contribute to DRT as well, which is the Achilles heel of left atrial appendage occlusion. So exciting times. Thank you very much for being on Heart Rhythm TV and sharing your story and your paper with us.